You are ready.
I am Dr. Ali Sarpkaya. Good afternoon, dear colleagues and guests. I am Dr. Ali Sarpkaya. I'm a doctor who specialized in eye surgery and living in hospital in Istanbul. I work as an ophthalmologist, like previous member Jem, in a member of high quality large hospital groups of my country, which is presenting also here, Medical Park Pendik. So what I am doing now here is I am cheating on my hospital with my own wife's clinic. As you will understand, the situation is a little bit complicated here. I am here to introduce Atasehir Physical Therapy and Rehabilitation Health Center, which was founded by my dear wife, Ülkü Sarpkaya. Not every institution in our country can serve foreign patients, you know. It must meet certain standards. About 2 years ago, we established Atasehir Physical Therapy and Rehabilitation Clinic for my wife, Dr. Ülkü Sarpkaya. We have recently obtained the certificate of providing this service by meeting the standards. Our clinic is quite young compared to the giant organizations here. We reach...
Slide'ları değiştirmeyi unutmayın Ali Bey.
I'm sorry?
Change your slide as well, please, when you're
Okay.
talking.
We reached Mr. Emin to consult what we can do about it. Luckily, I was know him from that last year I had made this eye surgery for his family member. Maybe she was his sister at the Yalova district of Istanbul. He talked about this organization and invited us to participate. This was a week ago, while I was thinking that maybe we can attend this meeting as an observer. My wife put her hand on my shoulder and said that she trusted me for handling this. Our unit was newly established. We did not have an experienced team yet mastered this subject. We did not have brochures and videos. We did not have an international presentation. Unfortunately, as a busy ophthalmologist, neither I nor my wife had the time to deal with this. But as a husband with 30 years of experience, knowing that my wife's request was actually an order, I immediately got to work. During this time in a week, I prepared 3 videos, lots of brochures, promotional information, and these presentations. My father always said before best way of learning swimming is directly jump through the sea. So I'm acting this way now and really enjoyed very much actually. I think medical skills and language skills are located in 2 different compartments of the brain. If one is big, other is small. So although we are a graduate of Hacettepe, our English is not very good. I'm currently presenting because I use Google Translate better than my wife. So I have a fault. If I have a fault, please forgive us. Let's start my presentation. Atasehir Physical and Therapy Center is a special health institution providing boutique service in Atasehir, Istanbul, in the heart of Istanbul. It is between the 2 airports, in the middle of the 2 airports. Very peaceful this thing of Istanbul. And we have lots of local patients and lots of foreign patients here. Our clinic is an integrative and functional medicine clinic that performs physical therapy and programs together with complementary medicine practices. We have 500 square meter area. You know, I said before, we are a small business. But we have 6 therapy rooms, 1 orthopedic rehabilitation unit, 1 neurological rehabilitation unit, 1 sport rehabilitation unit, pediatric rehabilitation units, and scoliosis rehabilitation unit. Also, we have EMG and EMG biofeedback rooms, lymphedema treatment unit, chiropractic manual therapy unit, and 2 traditional complementary medicine room, 1 ambulation and 1 magnetic field therapy rooms. Our medical team, Dr. Lüksarkaya is a physical therapy and rehabilitation specialist for 22 years professional experience. We have 5 physiotherapists, each with a master's degree in special expertise. 1 nurse trained in traditional and complementary medicine methods, 1 dietitian with a master's degree in child support and functional medicine. Dr. Lüksarkaya graduated from Hacettepe University Faculty of Medicine, which is very well known in our country, one of the best faculties in medicine. She's also doctor in functional medicine, which is one of the few physicians in our country specialists in this field. Also, she's master in Neurotherapy. She's teacher and instructor and vice president in the scientific association established by physicians who apply this method in our country. She also makes for 15 years Neurotherapy, Acupuncture, Ozone Therapy, and Mesotherapy and PRP. Our physical therapy and rehabilitation programs consist of we have orthopedic rehabilitation unit, pediatric rehabilitation, so we do scoliosis rehabilitation, neurological, hand rehabilitation, occupational therapy. We are lots of opportunities, TECAR, extracorporeal shockwave therapy, chiropractic, manual therapy, unit kinesiotherapy, lymphedema treatment, and grandstone massage. Our physical therapy and rehabilitation programs, we successfully implement rehabilitation programs for all orthopedic, neurologic, pediatric, and geriatric disease in our clinic. We also support performance athletes from sport injuries, especially football, volleyball, basketball players in professional athletes. We give service and ensuring their rapid return to competition. Early return after the acute condition causing the pathology ensures that the gains begin early. We also give nutritional regulation and supplementary support that will strengthen the general health status of the patients, are provided according to the needs. The treatment protocol is made by Dr. Lüksarkaya and applied by experienced physiotherapist. How long the treatment will take depends on the course of the disease. Also, the aim is to complete the treatment as soon as possible to ensure maximum independence. Neurotherapy, ozone, acupuncture, prolotherapy, and toxin applications are used when necessary to support the rehabilitation process. We can implement a personalized rehabilitation program for foreign patients 7 days a week, 2 sessions a day, for a total of 4 hours. Our traditional and complementary medicine methods are functional medicine, prolotherapy, PRP and stem cell therapy, neurotherapy, acupuncture, dry needle therapy, ozone therapy, mesotherapy, cupping treatment, and we do VEGA tests in some cases. Let's start with these methods. Functional medicine is a new approach to deal with chronic health problems. Functional medicine is a new branch, I already mentioned, branch of medicine that studies the origin of chronic disease. The first evaluation starts with detailed story-taking up to an hour by Dr. Lüksarkaya. Advanced biochemistry, microbiological, and genetical tests are used in addition to standard tests. Necessary supplementary support is provided by evaluating the body hormone balance. metabolism and toxin load at the tissue level, and vitamin and mineral deficiencies at the intracellular level. Elimination diet program is supplied with our functional medicine dietitian when necessary. We do immune system imbalance, and the presence of continuous low-level inflammation causes chronic problems, you know. The most accurate management of age-related degenerative process, curing chronic disease or preventing them from harming the person by controlling, are provided with a functional medicine perspective. Functional losses occurring during the disease process are also treated with physical therapy and rehabilitation applications and traditional complementary medicine methods. Dr. Ülke is also do prolotherapy treatments. It's a kind of regenerative injection methods. Prolotherapy is the general name of the local injection applications methods applied to the areas where the ligament attaches to the bone. Injection solutions can be a hypertonic special mixture that creates proliferative stimulation, as well as PRP, GDF prepared by centrifugation from the person's own blood, or we can do autologous stem cells obtained from patient's adipose tissue. By stimulating stem cells and growth factors at the injection site, it is aimed to provide repair of the damaged tissue. Dr. Ülke Sarpkaya works as an instructor, teacher, and vice president in the scientific association established by physicians who apply this method in our country. With prolotherapy method, we treat, especially in elderly, joint degenerations. We treat resistant neck and back pains, spinal disc herniations, recurrent headache and migraines, joint injuries by sport, caused by sport activities, knee pains, tennis and golfer's elbow, shoulder pains, and frozen shoulder also, carpal tunnel syndrome, nerve compression syndromes. Especially, we use this method, osculate pertussis disease, which is caused by avascular necrosis, disruption of the structure of the bone due to insufficient blood flow. It's very useful in this condition. Also, persistent pain after foot and wrist sprains. It's important in basketball or volleyball players. Heel spurs, scoliosis. Heel spurs is very bad pain condition in foots. Scoliosis with combining short exercises, especially in adult age. This therapy is very good. Also, we use this therapy for coccydynia, coccyx pains, fibromyalgia, and a specific jaw joint problems, instabilities. We can fix it with prolotherapy, jaw joint instabilities. It is very important in the scoliosis pathology also. Dr. Ülke also is a master in neural therapy, almost doing this neural therapy almost 15 years. He get this method from Germany, almost for 3 years she attends. Neural therapy is an effective treatment method widely used in regulation and pain clinics in many European countries, especially in Germany, France. In addition to relieving painful trigger points with protein-based local injections, physiologically and pathological irregularities that play a role in disease development are identified and treatment protocols are established. We use especially this method. It's very powerful in migraine, cluster and tension headaches. Also powerful in fibromyalgia, in rheumatic disease. Also pain management in hernia and arthritis is done with this method. Lots of painy areas, knee, shoulder, elbow, tendonitis locally can be treated. Sport injuries also, neuralgias, it's very important. We use this treatment, trigeminal neuralgia, zonal pains, and sequela, neuropathic pains, and phantom pains. Also, it's very useful in fascial paralysis in early and not late cases. In late cases, it's very resistive. Also use this method, carpal tunnel syndrome and ulnar groove syndrome. Also useful restless leg syndrome. Also in some particular usage areas, sleep disturbance, chronic fatigue syndrome. I think it is the best way, Berkey. It's the best way to manipulate depression, mood disturbances, lack of motivation, and wasting syndrome can be treated or relieved a little bit with neural therapy. It's a very important method. Also, we have lots of patients around whose child's name is Ali and Ülkü, because lots of functional infertilities maybe respond with neural therapy methods. We don't so much we might tanıtmak present so much, but
promotion.
Yes, promote this, but it's useful. Also, lots of hormonal disorders, menstrual irregularities, premenstrual syndromes, like that. It could be used for helping birth with making quick opening of cervix. Some of our patients or relatives wants to ask for easy delivery of their and acupuncture could be used also for this. Also, we can use this method, chronic tonsillitis, sinusitis, and allergies, and also use detoxification and anti-aging procedures. Ozone therapy is a very effective treatment and popular in Turkey, maybe all around the world. I don't mention lots about ozone therapy. We put this presentation in our booth sites, and everybody can download and see what we are doing about. Ozone molecule, produced by medical oxygen with the help of special generator. We can use systemic, local, rectal, and bagging style. Systemic use for general health, and for local use, like it's vaccine, works like vaccine. Rectal use maybe is appropriate for pediatric use. Bagging style is appropriate for especially diabetic wounds. We use this therapy. Also, I have a video, but I cannot start. Maybe in our booth area, there is a good video about the ozone, what we do in diabetic wounds. It provides oxygen usage for tissues. We are especially use this method, arterial circulatory disorders, diabetic or neuropathic problems, lots of chronic problems also, we use this method. Ozone increases physical, mental stamina and performance. Also, it can be used for anti-aging procedures in geriatric people. Also, we use very much. Acupuncture, everybody knows acupuncture. She's almost doing acupuncture for 15 years. We use this musculoskeletal pain problems, and also regulatory medicine. Especially we use acupuncture in obesity, smoking cessation, migraine and tension headaches in particular time. Lots of indications. Manual therapy also use our patients. Manual therapy is often used to treat skeletal and muscular system problems related to muscle, bone, joint, and connective tissue. It is a reduction of the joint, restoring the normal axis without going beyond the physiological range of motion and without exceeding anatomical limits. This procedure straightens the joint completely safely. We especially use manual therapy in chronic and acute pains and scoliosis treatment, postural disorders, also lots of pain areas, and they can read from our presentation. Also, we use dry needle therapy, especially in trigger points in the muscles. In fibromyalgia and myofascial pain syndromes, we use dry needle therapy. The needle is inserted into trigger points in the painful muscles to resolve the spasm in the muscle. When the spasm in the muscle is resolved, the length of the shortened muscle is restored. The pain caused by the muscle disappears and the dysfunction caused by the short muscle improves. Maybe we can talk about Schroth method exercises for scoliosis. We are a very expert team, and we are very popular in our local patients, in low-level scoliosis patients. We use Schroth method in a non-surgical scoliosis treatment, and that uses specific scoliosis exercises according to the patient's spine curve. We have two expert physiotherapists, which they get their specialty from Germany. They do a specific exercise for the fixing of scoliosis. It's very effective. When used with other modalities, such as neurotherapy and prolotherapy, it can be also usable in adult patients. We do a special program for scoliosis. Migraine treatment, we have also very popular in migraine treatments. You know, migraine is a complex disease potentially determined by the interaction between genetic and environment and lifestyle factors. First of all, we found the reason of the migraine. Which type of migraine the patient have? It's cause maybe hormonal imbalance. It cause maybe from neck joint instabilities, or some other pro-inflammatory and oxidative problems, mitochondrial dysfunction, etc. First of all, we found the exact reason and treat the reason first. Stress, dietary nitrate, dehydration, and hemoglobin G-mediated food allergies, etc., play an important role in the occurrence and frequency of migraine symptoms. We are very successful about in the, and we have 95 or 96% complete cure sometimes possible in particular cases. Sometimes it's possible to get rid of migraine permanently by using one or more of these methods: functional medicine, neurotherapy, ozone, VEGA Test, this directed nutrition program, and acupuncture methods. Fibromyalgia is also same. Patients typically experience widespread musculoskeletal pain. We are also very successful about this disease. I don't want to bore you, but we use different modalities in fibromyalgia also. It can be effectively treated with functional medicine measures, ozone, acupuncture, neurotherapy, and VEGA Test guided health and nutrition methods. We have a very good expert in lymphedema treatments. Lymphedema is a very terrible condition. There is abnormal water and protein accumulation in the subcutaneous tissue as a result of the decrease in the carrying capacity of the lymph system. Below normal lymphatic load is called lymphedema. Primary lymphedema occurs due to developmental disorder of the lymphatic system. In secondary lymphedema, there is mechanical failure. It is most common after surgery and radiotherapy. We do manual lymph drainage. It takes almost 1.5 hours for a physiotherapist. It's a manual drainage method in patients with lymphedema to correct lymph formation, to transfer lymph and tissue fluids to provide movement, to increase lymph flow in the patient's affected lymph vessels, and to loosen the fibrinized connective tissue. In addition, lymphedema program, we also use undulation device treatment. We add the undulation device to lymphedema drainage program. We have also different methods, active cell technology. This technology is used most resistant pains. We use this method especially in resistant pains. Can be seen in our presentation in detail. High intensity laser therapy is also used frequently in our clinic. High intensity laser reaches more deep structures and accelerates the healing process of the area and eliminating tissue edema in all depths of the traumatized tissue. Also, we use very well-known treatment, extracorporeal shockwave therapy. I don't mention so much. Sorry. Also use very popular in Turkey, and Tekar therapy is very, very important to treat sport injuries and pain problems. Very rapid healing can be occurred, could be VEGA Test. It's a kind of diagnostic device whose technology is based on the electroacupuncture method defined by German school. We evaluate, general evaluations are made about the state of organs and systems to root out the body, the physical work and order and energy status of the pain. We use VEGA Test especially to find the reasons of the chronic disease also. We do some special VEGA Test guided diets. Also, chelation and detox treatment could be done in especially heavy metal accumulations. We have a smoking cessation unit, cup and hajamat therapies unit. Also, we have aesthetic and beauty units, especially doing mesotherapy, well-known mesotherapy, PRP, GDF, salmonella, Ash100 mesotherapy, golden need radiofrequency, and other measures can be found in our presentation. So, there is the reason we can be preferred. What is the reason we can be preferred? We know we are a small business, very huge groups. They made a presentation for 3 days, and lots of them very professional, especially Physiomar group. Maybe they are very powerful in child groups, and Romatem is very powerful in the high technology, robotic things, and like that. And we have very good facilities in physical therapy and rehabilitation. But the reason we can be preferred, we are a high-quality boutique institution that provides high success in diagnosis and treatment with our experienced medical staff. We have the chance to take care of our patients in detail. We work hard on COVID measures. We use all possible protection methods for our patients. We clean everything, including air, after a patient before taking one another. We do not have a crowded and complex environment, especially in COVID days, because we work in one branch and one physician. We can use many different diagnosis and treatment modalities together. We are a clinic that attaches importance to ethical values, and we know our limits. Unless necessary, we do not give our patients to surgery. When surgery is required, if desired, we help patients to reach the right surgeon under the right condition. We can implement a personalized rehabilitation program 7 days a week, 2 sessions a day, as I mentioned, for a total of 4 hours for 8 patients. Accommodation in quality hotels close to our clinic. All transfers after the airport and interpretive support can be arranged by us. If patient reports could be sent us via mail or WhatsApp, we can quickly return and make all arrangements to all patients. Also, as you know, as a last speech, I know I'm last speech. As you know, international patient tourism has become a national policy for our country in the last 20 years. Our country has a very inspiring success story in this regard. 30 years ago, anyone who had money would have their medical and surgery in America or Europe. Thanks to the correct structure and investments, patients come to our country from all over the world. I recently performed an eye surgery on a patient who is a professor of nuclear physics in Canada. Just a week ago, I performed the surgery on both eyes of a patient who was sent to us from Saudi Arabia because it was so difficult and complicated. In our country, we have a large health army that successfully performs the most complicated treatments and surgeries for all kinds of disease. I can say that I am proud of my country in this regard, especially in these COVID days. Trust is the hardest and the most expensive value in the world to buy. It does not form easily, but lost quickly. We have established a long-term trust relationship with our local patients. As a last word, we can never give 100% assurance about the treatment of your illness because every treatment has some limits. But what you could trust for us is we can give 100% promise that we can do our best within the framework of our traditional Turkish hospitality and goodwill. And this was our last visit in Ukraine. I think this bad days will gone and we come back and visit Ukraine again. Best regards from Turkey.
Thank you very much, Dr. Ali. We have several questions come from platform.
Yes. I have two dictionaries, which is my son and my staff here.
Yeah. Good.
If I have a problem, they can help me. Okay.
Sure. Actually, some of our, most of the questions coming from the platform about collaboration, affiliation, and also kind of training. If some physical therapy and rehabilitation centers in Kyrgyzstan and in Kazakhstan, they were listening to you actually, and they were asking whether they can cooperate on the know-how and training exchange together, or if they can have kind of affiliation with your organization to use your technique and know-how, share with them with your loyalty fee or with affiliation fee. Is it possible?
Yes, it is possible because we are doctors. We are, I think, every doctor should share their ability to all people. You know, the law and the knowledge become bigger with share. So we are doctor in Turkey almost 25 years. I am doctor, eye surgery ophthalmologist. My wife is working almost 12 hours in clinic and maybe 5 hours in the home, study about their methods and teaching someone. So we have academy. We plan academy. You can help us, Mr. Amin.
Sure.
We can initiate something, institutions, and share our knowledge with a little fee to all over the.
Just to cover the cost,
of the doctors. We can share everything. Everything is possible. She's also an instructor, teacher in Neurotherapy methods, but we can share everything. Our clinic is open for everybody. They can send their request from, they can find me my phone, WhatsApp number, and mails. They can send their request. They can send their patient reports. We can do second opinion without any fee, no problem. And if we can do something for them, it's appropriate. It's no problem for us.
That's great to hear, Dr. Ali, that you are open for education and you have an aim and dream to start with the academy of sharing the know-how and knowledge and experience that you are gaining in Turkey with our neighbor countries. That is great of you, and thanks for that thinking globally and thinking in humanity side, actually, humanitarian side and humanity side. Thank you very much for that.
You're welcome.